also thinking about how we address other issues that don't specifically relate to the health study. So that will all be done by the range of Department of Health people around the building. We also have Rosemary Lester, Chief Health Officer here, who will do a little presentation after our first session. So I'll just talk about the agenda now. What we want to hear, and the Department of Health really wants to hear, is your ideas, your concerns, your issues around the health study. So we want to spend the first 20 minutes, half an hour or so, getting those out on the table so that everybody in the room understands what different individuals in the room have got concerns about and issues with. So that's what we're going to do. Then we'll hear from Rosemary, who will talk a bit about where the Department of Health and the government's at in terms of the development of the health study. And Rosemary will take that opportunity to answer a few questions. Just before Rosemary does that presentation, I understand there's a number of people or a person who wants to present a petition to Rosemary, so we might do that at that point. Okay, so just before Rosemary's talk, we might actually do that then. And following that, we want to try and address a couple of issues with you around, well, given all of those issues that you as a community have raised and the ones that Rosemary's raised as part of the development of the health study, which ones of those are really important to you? So we'll spend a little bit of time at our tables just working on that. And we also want to get a bit of feedback about how the community would like to see the ongoing engagement transpiring. So what do you want in terms of community engagement and feedback through the life of the health study? So they're the sort of questions we'll be trying to answer as part of that little session. So has anybody got any concerns or issues with that in terms of a process that they'd like to have a bit of a discussion about now, or if not, we might just get into it. Does that sound fair and reasonable? Now, I did try earlier today without the microphone, so I think with this small group, if we're all paying attention, I think we'll probably get away without it. But if people are having trouble hearing, please let me know, and we can get the microphones going. So I might just reiterate that this is about constructive advice to the department about the preparation of the brief for the long-term health study. So we're at a very early stage, so it's about getting your concerns and issues on the table so that the department can listen to those and try and address them and make sure that this health study is meeting the needs of the community. In my experience, I've worked in the government for 35 years, and it's not an opportunity you get very often to be involved in the process right at that point. And I think that's, we want to make sure we make the most of that opportunity here. It's not the last time that you'll obviously have input into the health study, and when the preferred consultant or researcher or scientist, whoever it is selected down the track, they will actually need to undertake a engagement and feedback process with the community as well. So that's that second question I was talking about that we're trying to get to. Okay. Everyone happy to kick off? So as I said, the first 20 minutes, half an hour, we're going to just hear from the community about, what are the issues and concerns that you people have in relation to this long-term health study that's being proposed. So, does anybody want to kick us off? Yes.
Somebody else was going. I've got a question about the period.
Sorry, I should have had it just before we start. I apologise. All of your concerns and issues will be documented.
Yep.
There will be, and how the department is going to deal with those issues and concerns will be published via the web, so the website. If you have difficulty accessing the web or whatever, please let us know before you go, and we can actually arrange to get hard copies of that sent to you. So, but it will be published on the web down the track once all of that's been consolidated and the department's worked out how they're going to deal with that. We won't deal with all of your concerns tonight, and in fact, it's much more about listening and learning what the concerns are so that we can go away and consider those concerns and issues and come back with a considered response. Okay, sorry.
That's okay. My question was about the length of the study being 10 years. How hard and fast is that? So if we do get information that says there are effects, people are being affected, is it cut off at 10 years, or is this a flexible sort of, let's look at this and maybe we do need to extend it? Is there any flexibility there?
I can have a crack at that because Rosemary dealt with that this morning in the session. So the issue is around government contracts. So government contracts can't be let for more than 10 years at the moment. But certainly the Department of Health's view is that it should be a longer term period than that, and that will need to be managed at the time. So what we've done in terms of recording the information from this morning's session is that we will be certainly letting government know that the community feels it needs to be a longer term study than 10 years, and seeing what they can do about that in terms of making sure that that's the case. So
just so I'm clear, this is sort of the 10 years this is where we start, and then we will work through.
The view of the Department of Health that they would like it to be longer term than that. Yeah.
Yes, Geoff. What I'm concerned about, I've lived around this area for over 40 years, and I've worked on all the power stations.
Can everyone hear me, or do you need? Yep. Not up the back. Yep.
We've had health studies in the past, particularly around asbestos and asbestos-related issues. And what has happened is whoever was appointed, like Peter McCallum or someone else, they've just taken their study, gone back to Melbourne and done it, and then reported to the government, and that was the last we heard about it. What we need is a community empowered situation where the community can find out personally about their health, apart from doctors' files and all that sort of thing. And what I'm proposing is that something like a register, all-encompassing register, fed into by various medical centres and the Department of Health. So at any time, community members can get access to it, rather than just what I would say a disjointed statement or information from whoever's appointed. I think that's important because, having attended a couple of these mind-fire meetings, it's obvious, and showing due respect to Rosemary down there, that the community doesn't trust the information that's coming from government, or at that point government departments either. And if they appoint someone that is a stranger to the community, they're less liable to get accurate information. So that's all.
Thanks, Mark. Any other? Yep.
Is this going to, well, the people, is it going to encompass the entire Latrobe Valley, or just Morwell itself?
Well, again, the department's very keen to hear from you about what you think it should cover. I can tell you from the session we had earlier this afternoon that the general opinion was that it should be much broader than just Morwell, but the department would be keen to hear from you guys what you think it ought to be.
Are they going to inform local doctors and everything about their findings as the study goes along?
Well, again, that's part of the what I'm hearing you say is that that's what you would want, and that's what the department wants to hear. So that they can develop the brief and let the consultants know that that's what needs to be done. So if that's what you're suggesting, that'll be recorded, and the department will certainly take that on as part of the development of the brief. Yes.
What about how this has affected people mentally? a lot of, being locked in a house literally for 6 weeks has a big impact. How it's affected children. Children had to relocate schools. They couldn't go outside and play. They couldn't do their normal things. My son himself would pick him up from school and say, I don't want to go home, my house hurts me, because of that's how it affected him. Emotionally, mentally, are they looking at supporting people through that?
Well, again, as I said to the gentleman next to you, that's certainly what the department wants to hear, those sorts of things. So they're very keen to have your views about that's what you think the study should deal with. So, and again, that particular issue was raised in the earlier session today, that there is issues around children and how they've had to deal with relocation and dislocation and all those sorts of things. So, yeah. Yes, ma'am.
Is there an interest in whoever takes on the tender? Will they be given the data that was collected from the community already? Regarding their health and what they're experiencing throughout the fire?
I'm not sure, but if you want to hold that question, it might be something you can ask Rosemary when after she's done her presentation and come back to that one.
The smoke when they're coming from the power station, the smoke, from the pipe, it's clean from toxic ash, or when it's coming, the smoke, it's coming with ash, and when it's weedy, sometimes I'm a little bit far away, but sometimes when the power station is working a lot, and I can see in a photograph, it's coming a lot, like big cloud on the sky, but it's no cloud, it's smoke, and sometimes I feel problem with my throat. I never have problems, Yeah. I have problem with my throat when I have a cold, but not like that, first time. Another thing, the area in the mine over there, when they're digging, they keep it clean all the time, because if the toxic acid is outside, if it's weedy, it can go everywhere. They need to be clean and tight all the time, and the mine is supposed to be covered all the time. If somebody throw one cigarette or anything, when I go inside, I cause fire in the mine, like last time, because I'm new in Morwell, about 3-4 years now, I'm going the 4th year. In 2012, I think it was a mine fire, even some years before, just the mine, not in the bush, all in the mine, And so to prevent mine fire, we need protection around the mine. We need to be covered by something.
Yeah, so
all times.
I could summarise, you're concerned about what's coming out of the power stations, and you're also concerned about ensuring...
And it's clean, and if they got filter,
yes,
and that smoke must be 100% clean, for the environment.
We can certainly cover that off in terms of documenting that. It's not really to do with the study, but we can maybe perhaps find some information that deals with that. In terms of the second point about the fire suppression and ensuring that there's no fires in the future, I'm sure that'll be part of what's picked up as the broader mine inquiry, but we'll certainly record that as a concern and let people know that that is a concern that came out of these meetings.
I think something that may not have been apparent to a lot of people is my old favourite waterhole creek down in Morwell East. The water from there mainly comes from Hazelwood Power Station and a couple of small creeks around Curnow Lake. And during the fire, it was switched off. So there was no water going through the creek at all, because the creek doesn't flow naturally itself. So all the nasties that Hazelwood Power usually let go night time around about now would float down and float into the creek. The creek in turn flows into the Trade River and then in turn to Lake Wellington. So it is a health hazard with whatever goes into that creek. And also people living around here actually go and check sporting facilities like tennis courts, as far up as St Vincent's, you'll find instead of being green, they're black, dark grey. So, people need to be aware that the Hazelwood Power or GS Sewers or whatever they call themselves now are not really environmental friendly. They do what they can get away with.
Yeah.
We'll certainly take that on board. Hang on, we've got some other ones.
Hi. Particularly in terms of the study, to look at the kids who were moved, so the schools that were moved, and then possibly compare that to the kids who actually stayed here in the schools that weren't moved, and the same to particularly look at the carers for the nursing home that was moved, and even the stress placed on the teachers and the education staff that were moved, and also the ones who didn't get the opportunity to move, because I'm a teacher myself. I'm well aware there's a lot of pressure gone onto those teachers in term one. One of our local schools recently lost a teacher through cancer just a couple of weeks ago. Those schools have been under enormous pressure, and it'd be quite fascinating to study those kids as they go through.
Okay, thank you.
I have a question about you're going to do a health study on the Trove Valley, and you're going to use another town to compare it to. Will that be like a local town, like in Sale or something, or will it be in New South Wales, like another coal mining town somewhere else? Or?
Well, again, the department is keen to hear about what you think it should be.
It should be like a town that's in the same sort of weather, same sort of environment, I guess.
I can just, if I paraphrase a little from this earlier this afternoon, there were some suggestions that it needed to be a similar, mining type area. There were some who said that no, that wasn't the right way to go. Perhaps it should be completely different. So
it should be like a clean area, and then you can compare the diseases and everything, the Trove Valley against that.
So there was a couple of different views there about that. So it'd be interesting to hear from this community group what their views are.
Would the health study, the people that are doing the health study, keep in contact with the local doctors so that they can find out that way if there's any acceleration of any diseases or problems through that could be related to the fires?
Well, again, I think if that's what you're suggesting should happen, then I think the department can take that on board as something that might need to be included in the brief. So,
because I know there's quite a few people that are having problems now that didn't have them before this fire started.
Yeah.
Will flora and fauna be included in the health study?
Again, I think if that's a suggestion that needs to be considered by the department, then I'm happy for the department to record that, and they can go away and have a think about that, about whether that should be something that should be considered.
And further to that, with Hazelwood, there were 8 to 10 tonne of fish that had passed away at the same time, and engineers had to get subcontractors in to get a semi-trailer and remove that. No one wants to talk about it. I've seen photos, but I'm not allowed access to them. That sort of thing would be very important. Are people going to be mandated to offer that sort of evidence?
I think the short answer is I don't know, but I think if you're suggesting that those sorts of things need to be considered by the proponents of the study, then I think I'd put that forward and just see what the department can do with that. Yep.
Another thing I can see in Gypsum, not just Morwell, the population is very, very much, and there are even lots of people now, as many years before, all right? We have now very big hospital. That means there's living lots of people in Gypsum and Morwell everywhere, here. And the power station is very close around us. That's the power station we've got in Morwell. It is the biggest from the other two, all right? And actually the government, I heard in the news, he say he's going to help him to put again the pipes and the pumps in the mines. Why the government must help him? Why the government have to put the money in his pocket to help him? No need. He got before, when he bought the power station from the government already had pipes and pumps in the mines, but not the government have like the mine he's got now. He's digging a lot. Anyway, why not put it back again, the pipes and the pumps he find from the government? And he spent his money. And another thing, the pollution is so much. Many people, they're getting sick.
Yes.
Many people, even workers, even unworkers.
So can I just pick up your first point there? I think you were saying that the government shouldn't be paying for new sprinkler systems to go into the mine. Okay. So, we can certainly record that.
Why? I don't know. Why we have to pay these things?
I think it's important to include all the people who worked in the mine at that time, so all of the fire guys and the people who were there, all the catering staff, all the support staff that were involved and highly exposed to all of that at
And
the
all the
time.
people that live outside the area but working there.
Sorry, can I just pick up on that? And, the people that were, we were just saying that live outside of the area but were coming into
But
the
work
area
into the
to
area
work.
or drive through the area even.
So capturing that.
Yeah.
And could I pick up on the point of the town comparison? Because it sounds to me like what you're wanting from us is for us to say what we feel should be happening. I'm listening to you paraphrasing there and going. So can I put forward that I believe that in terms of comparing that I think it should be compared with a clean town or a town not near a coal mine to actually see what the differences are between those that live on top of coal mines and those who do not. So.
Yep. Just following on from what this lady says, if we did go for a coal mining town, you'd have to bear in mind that brown coal in Victoria and black coal just about everywhere else.
And just on that, Tracy, the thing is what we're looking for is the effects of the mine fire. So we need to, compare apples with apples. We need to compare a mining town with another mining town, but this one had a fire. This one did not. Otherwise, you could get a very unclear.
Maybe you need a combination of both.
Yeah,
because
that way you can really see a difference between clean and what we've gone through because of all the ash and everything and the smoke, and one that's been like a normal coal mining town but hasn't had the same sort of thing that we've experienced.
So I think, as I said earlier, there were certainly different opinions about this in this morning's session, so that'll be something for the department to go away and have a bit of a think about in terms of the best way to go.
I don't understand why we need to compare ourselves with any other coal mining town or any other town. We were promised, Latrobe City councillors were promised during the fire by Craig Lapsley, the Fire Services Commissioner, Rosemary Rosemary Lester, Chief Public Health Officer, and John Merritt of the EPA, that there would be a public health study, and it would be based on the planned burn study, which was conducted in Traralgon and in which I am a participant, and I live one street away from where the Morwell mine fire is. And I would like to say how very grateful I am for their positive response, and that there was an immediate response from Monash University, who actually set a date for the start of this study, and the date for the start of the study was during the fire, but nothing happened. Our local Member of Parliament, Russell North, received an email in which he was told that the indicative cost would be $250,000 for 100 people to participate. He did not respond to the email, and what happened during the mine fire was that the Deputy Premier, Peter Ryan, announced $250,000 would be spent on new playground equipment in Morwell South. And so I would like to say that I am absolutely disgusted with our politicians. This should not be a political matter. I truly believe that our Chief Public Health Officer did everything properly and correctly, and that she could only operate under the data and information that she was given by the EPA. However, the EPA, their whole operation, their whole mode of operation was a total shambles, and that Latrobe City councillors had meetings on 2 occasions explaining the need for proper monitoring systems. So I would like to suggest that we have a proper system, a public health inquiry, and that we look at the same, what that you call KPIs or whatever for human beings. So in the study that I participated in at the courthouse, this included looking at my hemoglobin levels in my blood, and I received a letter from Monash University advising that there was something wrong with them, and that was because of carbon monoxide poisoning. And the longer that you delay this study, people will just go back to normal, the carbon monoxide poisoning levels will change, and an opportunity will be lost. So I've waffled on a little bit, but I suppose this is an opportunity to register my disgust with our local politicians, and to say that I do believe that the Chief Public Health Officer did her best and that she got straight on to Monash. That's my understanding anyway.
Thank you. We'll note those concerns. I might just take 1 or 2 more before we go into the next session with Rosemary, if there's any. Otherwise, we might invite Rosemary to come up and receive the petition first of all, and then do your presentation.
Yeah, well, I'd just like to say a couple of words to Rosemary about that circular. I've been downtown, and I've seen a circular that has a photo of Dr. Lester on it, and it says that the study should be about life, not death, or some words to that effect. I found it rather offensive, and as our counsellor just said, Dr. Lester did her best under the circumstances and given the information that she was supplied with. So I'd like to apologise to Dr. Lester for any offence given, and disassociate myself from the organisation called Voices of the Valley. They're not my voice.
Thanks, mate. Rosemary. Now, did you want to say something about this petition, or?
No. Okay, as probably most of you know that are here, that we launched an online petition lobbying for a health inquiry. There's over 25,000 signatories that here. That's including, there was 25,000 online signatories, and there's quite a number that we've collected from throughout the town, actually. It is well over 25,000 signatories. We were then aware that a health study we were made aware that a health study had been announced. We had already flicked an email off to Rosemary Lester's office asking her for an opportunity to give her the petition. And despite the fact that the health inquiry had been announced, Rosemary came back and said that she'd be pleased to receive the petition on behalf of the community. So we feel like, we were very grateful because it isn't something that she does need to do, and we do see it as a bit of an olive branch to the community, as extending that hand that we are wanting to work on this together, and we are hearing your voice. So I do so sorry if I'm waffling, but every time I'm wheeled out, I'm never prepared. So I will hand them to you because I think it says loudly and very clearly that there's a strong voice from the community that something needs to be done, and I appreciate the first steps of action that we're taking. And I also feel, well, I'm speaking on behalf of the community, but I feel that the community does appreciate these initial steps, and like that was said before, this is really early stages. We've got a really long road to go, and the best result, in my opinion, is going to be achieved when the entire community works together, and these consultations, and the debriefing and the talking together continues. So we do thank you. Certainly my team at Norwood House thanks you for giving us this opportunity. So thanks very much, Rosemary.
Okay, thank you.
So can we just get sorry. Sorry, because, so. Sorry. Oh, yes. Sorry. Oh, my pen. Yeah, sorry. It might be easier.
All right, thanks, Rosemary.
Okay. So thanks, Tracy. I do appreciate the enormous effort that you've obviously gone to engage the community. So as I mentioned, the fact that we are committed to a health study, we really are committed to working with you to try and get some answers on, were there any, or are there going to be any long-term health effects from this event? And we certainly hope that there won't be, but we are committed to that. I'd also like to thank Council and the gentleman here for very kind words about me, so I really appreciate the support from the community there. Perhaps just before I go into just a very brief presentation as to where we're at with the health study, if I could just make a comment on the Councillor's comments about the planned burn study. Monash University have been involved in this area and in other areas of the state about health effects from smoke from planned burns, and I do know that, as the councillor has mentioned, they were sort of coincidentally lined up to do some work around the Morwell area about the time of the fire. Now, I did speak to Monash University about that. My understanding is that they decided not to go ahead with that because of the mine fire and because it was going to confuse the entire picture. So that's my understanding. I can't swear that that's the case, but that's certainly my understanding, that they decided to put off doing that work in Morwell just because of the mine fire. It would just confuse everything. So our deciding to do a long-term health study is actually quite separate from the planned burns work that Monash will continue to do with communities around where there's planned burning. So we'll just go into where we're at with the study. So obviously, why are we doing the study? We have heard the concerns of the community, that you are concerned about any potential long-term health effects, and we do want to make sure that we hear those concerns and address them. As we've mentioned, we don't expect to see any long-term health effects, but we can't be sure about that. So why are we doing the study? We need to look and make sure that if there is anything that we don't expect, that we identify it as soon as possible. I heard the comments about making sure that local doctors are informed along the way about anything which might be arising, and we would certainly look to inform both local doctors and you, the community, as we go along about anything that's arising. We want to be able to make sure that we learn from this experience, so that if God forbid that this sort of thing happens again in another community, that we learn from this event to improve planning and response to future events. And of course, we need to add to the international scientific literature, so that anywhere in the world, if this sort of event happens, then people can do what we were doing, searching the international literature to look at what might be both the short-term health effects and the long-term health effects, so we contribute to that international knowledge. So what we'll do is fund an independent research organisation. So we'll be putting out a public call for tenders in the very near future once we incorporate the feedback that we've received from these sessions into the brief for the study. So we will be asking an independent research organisation. We're not the experts in health research. We need to get somebody in who's independent of government and who are the experts in health research. They will obviously have to demonstrate that they've got the appropriate expertise. So they need to have expertise in health effects of environmental issues, and they need to be able to demonstrate that they're actually capable of doing quite a complex long-term study. Again, we've got ideas on what we think should be done, but we're not the experts, so we'll be putting those ideas in the brief, and we'll be asking the researchers to advise us on the final design and methods for the study. As I said, we will be advertising hopefully in the next few weeks for an organisation to do this for us, and we'll be obviously, because of the importance and the large nature of this, we'll have to select the best candidate very carefully. So what will we be asking them to do? We will be asking them to continue to consult and engage with you, the community, because as Tracy said, I think it's really important that we do this as a community, that this is not something which is done to you. At the moment, the discussions we've had both within the department and the external experts that we've talked to, the things that we think are important at the moment are to look at any possible heart effects or lung effects, any cancers, any effect on the birth weight of newborns, and the psychological impacts, including in children. We've heard that both earlier this afternoon and tonight, that people think that is very important. The researchers will need to obtain human research ethics approval, so that's standard for any research program which is done on humans, to make sure that it's done in the highest standard way, in the most respectful way, and respecting people's privacy. The 10 years, as Geoff said, the concern was raised earlier this afternoon as well as this evening about the 10-year time frame. It's really not reasonable for us to sign contracts for longer than that, but as Geoff mentioned, my hope would be that, and that's probably not going to be me in 10 years' time, my great hope would be that would continue for longer. But there have been some very good, very long-term studies overseas that have gone for 20 and 30 years, so my hope would be that it would continue longer than 10 years. We will be asking the researchers to provide at least annual progress reports. My hope would be that they would be more frequent than that, but we will keep the community informed. We've already set up a special site on our website, and we'll make sure that the researchers provide that feedback both to the medical community and to the general public. And obviously there'll have to be things other than the website for those who can't access the internet. So as I mentioned, the actual study design will be determined by the expert advice of the researchers. But the sorts of things that happen in long-term studies, the researchers will access existing databases. So we have a cancer registry, there's hospital admission data, which we would use to access the Latrobe Regional Health data. There's births, deaths and marriages. They would typically undertake surveys, so phone surveys or face-to-face surveys or online surveys about the sorts of symptoms that people are experiencing and how they're feeling about things. They will need to obviously set up their own data collection methods. They'll need to take a sample of the community and actually follow people up and take regular physical assessments. And obviously lung function tests would be something that we would expect that they would be doing. And the topic's already been discussed about a suitable comparison population. And it is quite an interesting discussion about is it another town next to a coal mine or is it a completely separate town? So we hear your views on that, and we'll discuss that with the researchers, and obviously seek their view as well. So we've come along today to hear your thoughts and record your thoughts. So though the information that we heard earlier this afternoon and what we've heard so far today has been very helpful in terms of you telling us what your concerns are in relation to the incident. We will provide updates on our progress at the website there. As I said, we will make sure we put it in community newsletters as well. And for people who weren't able to attend one of these sessions, we have put a survey on our website. So just a very quick survey saying what are the 3 things that most concern you that you'd like to see the study address. So if you have people who have access to the internet but couldn't be here, encourage them to take the survey. And we do have some paper copies of the survey if you want to give them out to other people. And we'll get those out through the council and other sites as well. So that's it. So thank you very much. And I'll hand back over to Geoff now for the rest of this evening.
Rosemary was very kind earlier this afternoon and did take a few questions, so she might do the same now.
Yeah, I'll do the same.
I'm going to start with the lady at the back who I deferred earlier. You were going to say a question for Rosemary.
No, it's okay.
Oh, okay. Right.
Given that one of the main conditions people had during the time was the sore eyes and the nosebleeds, is that something we should include in the study?
I'm not sure whether that is something that is, resolved now that the smoke is gone. I'm not sure about that. We can certainly put that to them.
I've got the lady at the back here now.
Sorry, I remember now. There was data collected on the 2nd of March at one of our events, so are we able to hand that over as well?
Sorry, who collected that data?
It was the Valley.
Oh yes, the gentleman gave me that data at the session earlier this afternoon.
Yeah, and will that be used in the study?
We can certainly give that to the researchers. There was a question, I'm not sure whether it was you that asked it before about data collection generally. We will be publishing, we the department will be publishing later this year a report on all of the data that we collected during the incident. So from general practice, from the hospital, from Ambulance Victoria, from Nurse on Call, and from the Community Health Assessment Centre. So we'll be publishing a report on what sort of things we saw during the event. So obviously we'll be making that available to the researchers as well.
Sorry, I'll come back to you. I had Merv next, and then lady up the back, and then you.
Those terms and conditions you set for the researchers, they're very similar to the previous studies that have been done mainly on asbestos, like a literature review and minimum contact with the community and letting the community know every 12 months. It's not good enough. It should be empowered by our elected representatives like our council do. They should be involved, and I think if I've learned anything from the 2 Mine 5 meetings that I went to and what our councillor has just outlined is that people aren't trusting the government and in turn the government departments. They're more inclined to trust people that they've elected themselves rather than government departments and health departments. So I think you need to take a serious look at the model that you're presenting, and more seriously the researchers that you're going to employ. I mean, are they going to come from Melbourne? Are they going to be local? And is there going to be any input into the community for the evaluation of the tenders?
Just to, maybe I misrepresented on the slide what we'll be asking them to do. One of the key things I'll be asking, one of the key things I think is important is to take a sample of the community to monitor their health face-to-face with things like blood tests, lung function tests. So I'm sorry if that appeared down the bottom of the list and we emphasise databases, but I see that as a very key.
We don't want a sample, we want the whole community involved. The community wants to know about their health.
Well, we'll have to discuss that with the
others.
We'll have to discuss that with the researchers as to what the appropriate sample is and how they're going to select that. But we certainly hear that.
Cool.
I just have a concern that the study may be restricted to people that had no pre-existing conditions. But I think that the smoke's affected a lot of already existing conditions that have brought problems along quicker than they needed to be.
No, there wouldn't be any intention to restrict it in any way.
one here and then one there, and we might let Rosemary go after that.
In terms of the data that you're collecting, you're talking about collecting data about the human beings. The data that I see as being very important is EPA data, which includes the 6 different toxic or toxins that can be located in the air, like the PM2.5s, the PM10s, the carbon monoxide, sulfur dioxide, nitrogen dioxide, and ozone. So those 6, which are they are part of the national standards, and the EPA have let us down terribly by stating last year that monitoring the air at the Traralgon swimming pool is adequate for a mining community which has 3 large mines. So I would suggest that an important part of each of it is to include that EPA data for each day. And the other thing that's important is for each participant to be able to identify how close they were to the mine fire in terms of their geographical location. And this is something when we had asbestos issues in Moe and Newborough, that you found that there would be several people in the one street or whatever living in homes which had asbestos sheeting. There was a direct correlation. So it's not just about, saying, well, this person has this or this person has this lung function. It's also about being able to virtually predict, well, if this person was living 2 streets away and they were exposed to this much with the EPA, you can then almost say, well, from this study, we can then expand that to look at the neighbours in that street.
I think that's really important, and I think that's going to be a big challenge, sort of knowing from where people live and what the EPA data has, sort of how much exposure they have to the smoke. So I think that's a really important thing, and I think it's quite a tricky thing.
It is tricky. Yeah. It's possible to do though.
Oh yes, possible.
But I suppose what I'm saying is that it means that we'll need to involve more than DHS. It means that EPA need to provide their data, and I suppose people will give their addresses, and there will be, geographic information systems, coordinates. They don't really need to give the precise street number.
Sounds like a good point. This gentleman had one more.
There's a recent study that came out that said mine disasters are going to be a yearly event. I just wonder how you can pinpoint the health effects were caused by this one incident when it's going to be a long term. Like over 10 years, we might have 10 more fires. We don't, and there's nothing there to stop it happening. There's no preventative maintenance.
But can I just say though, I don't think it was actually talking about fires necessarily. But yeah, it's an interesting issue.
There is one thing about what the councillor said. A lot of people didn't live right up against the fire, that lived in other parts of Morwell, but they perhaps work in an area that's closer to the fire.
So yeah, that's certainly something.
And although they said that only Morwell South was a problem, it was a problem all over.
Yeah. Well, we've certainly heard that today, no question.
Yeah. It wasn't just certain areas. Thank you.
We might let Rosemary go there, so we can move on to the next phase.
Can I say something very important? Very recently, I find something that drinking water, the pipes, it is from asbestos.
No.
Yeah, there is a kilometers. There is a kilometers. There are a resident in my street. and they said to me that people, there is old pipes, and after last month, there is broken pipe, and I see there is asbestos pipe, and if there is asbestos pipe, there is a very close to the power station, and there's a fire over there, they're getting warm this pipe, it's not healthy for us too, you know, there's another problem, we have to do something about this. There's a kilometers, they've done it long time ago.
We'll certainly make a note of that, thank you for letting us know.
And they put now one PVC about 2 meters, 3 meters, and they're supposed to be done it on the down the road. It was more easy, you know, there was no driveways, no concrete, you know, nothing, but they didn't done it, you know, they're supposed to be done in that time. Now it's too hard, you know.
Thank you. We might leave that just there with that one. We'll make a note of that. Thank you.
Thank you very much.
I'm going to be really brave, given we're a relatively small group, and try and facilitate this next session myself, and we'll take some notes. With the larger group we had earlier this afternoon, we did split up into small groups, but someone said earlier to me if he did that, he was going to throttle me, so we won't do that.
And this pipe, they broken very recently, you know.
Yep.
So if it's fire, smoke coincide things.
So we're going to spend 5-10 minutes now just having a think about the stuff we heard earlier in the session from the community about the issues and the concerns and the ideas that were raised. Having a think about what Rosemary's just told us, and just is there anything that jumps out now that is critically important or we've forgotten or we didn't discuss before? So that's just 5 or 10 minutes to do that, and I've got one hand up already. Good.
Yes, look, I came back to the community. I left here in 1964, and I came back 5 years ago. I came back to assist my mother, but in my year 20s, which I was already gone from Valley by then, I had a problem with my throat called quinsy, which is not something very commonly dealt with these days. But since the fire, I had not had any problems with my throat previously, but since the fire, I find that I'm sort of coughing constantly or getting a tick or whatever. Now, I'm concerned because it's not my intention to stay in the valley. It never was. And so I will be moving away from this environment. I won't be probably part of ongoing consultations or anything of that nature. Now, I didn't go and register my health concerns or anything anywhere, so therefore I don't hear it part of the statistics. But it's very likely that I may have ongoing problems. Now, how does someone like myself then, become part of the process that's ongoing when you're not even...
So it's a very good point that you've made, and again I can say that earlier this afternoon people raised the same issue about people moving into and out of the community, and it'll be something that needs to be thought through in terms of the brief and with the researchers about how they grapple with that. So we'll certainly take that down as something that needs to be addressed. Is there anything else that has jumped out as a result of... We'll go here and then we'll come back to you, Christine.
From the last session that I attended this afternoon, I think there was a highlighted that there was going to be agricultural studies as well regarding, food crops, livestock, the effects of the smoke on, say, cows with their milk production. Is that right?
I don't know. I wasn't in that. I didn't hear that.
Well, I'm just a bit concerned because, with local crops, we're eating, the smoke has gone into the air, it's fallen onto the ground, we're eating the food,
It's a valid point to raise, and certainly we'll document that, and we'll ask the Department of Health to have a look at how that might be addressed and in what shape. It may not be part of the study, but it may be some information on whatever else that comes out as a result. Christine, you had another point.
Yes, I was just a little bit concerned about a headline in the paper last week that the super TAFE that we have here in Latrobe City feels that they are well placed to undertake a Health study. I just would like to point out that last year there was some discussion about our Monash University campus being taken over by the University of Ballarat. So it's headquartered in Ballarat. The Vice-Chancellor is a former kindergarten teacher, and our head of campus here has a background which is a PhD in the Seventh-day Adventist ministry. I'm just pointing out that I am concerned about an organisation with those sort of credentials headlining in the local paper that they believe that they have the capacity to undertake a study such as this. And I would also like to point out that there's been quite a degree of correspondence which is underway with the Victorian Auditor General's Office about the so-called takeover of our Monash University campus, and that it is also high on the agenda of Latrobe City Council to be looking at what happened, how it happened, and there is a strong push to get our Monash University back.
Thank you. We'll make a note of that. Thank you.
The most important thing, everybody, we must communicating together. Nobody is perfect. Nobody perfect. Everybody done mistakes. Even here, all of us here, even these people that they're holding the power station. So, not losing their money, just listen us what the problems we have with this. So, to solve the problems, because and after we win, our health.
So you're saying that we need a good communication strategy around all of this?
Because there's a lot of pollution around. We've got cows, sheep, things like that. What they eating? They're eating these dirty things.
Which I think is really, really important, and a good segue into our second question.
Yeah, and even aside the money, because most people.
Let me get the second question out.
Yes.
The second question is about communication, community engagement and feedback during this 10-year study period. Have you got some ideas and thoughts that you want to share with the department about how that should take place so that they can include those sorts of things in the brief? So that, you know, I think I heard Merv say earlier that, you know, an annual report's not enough. So what are we sort of expecting, and what should be in the brief?
And if I could, because this is something very dear to my heart, and I'd like to reiterate that the fact that this should not be some academic process that informs scientists. It should be informing the community as much as everything else. So there should be in my view, regular feedback to the community, both with formal reports and formal documentation, but also importantly, at regular milestones, a community forum where those sorts of results can be explained, because the scientific talk sometimes is difficult to understand.
I had one here, did you?
I just think it should include like local community groups like the normal neighbourhood house and stuff, so they can disseminate to their members and stuff. Because not everyone might hear what's going on.
I was just going, before you were saying that, I was going to say, well, I don't have the exactly ballpark of where we've got to be. I know where you don't need to be, and you don't need to be filtering out that information the way it was through the fire, because that was a mishmash of ping-ponging through things, trying to understand it, and it really does need to, I think we need more regular information coming through about that, whether that's once every 6 months or whatever that time frame is going to be. But the community forum and the community platforms are really the best places to deliver those, in my humble opinion. Just jumping in on that, sorry.
That we can understand.
Plain language.
Yeah, really, yes.
Well, we have a council here of elected representatives. The last council report I read had 1,015 people represented in our council. I don't know why we have to go to some far off organisation in Melbourne or wherever when we've got the capabilities in the Trove City to do it ourselves. And people are going to be more...
So to do the communication or the study?
Both. And I also think that, you know, the people, the community is more liable to trust their elected local representatives than strange academics.
It depends on the community member, doesn't it? Any other questions or comments about feedback, engagement during the study? Sorry.
Obviously needs to be put into a range of languages because we have a huge multicultural group in this, both new and old.
Yep.
I think one of the biggest networks that you could make use of is the schools, the primary schools, particularly secondary schools. And the kids from the secondary schools have said they would like people to come and talk to them.
Yep.
So there's another great forum, as you were talking about community forums. Get in there. These are the kids that are going to be, if anyone's going to be affected long term, it's those guys. So let's get them there. Or they're going to be the ones looking after me in my nursing home. So they're going to need to know
what's going on.
What's going on. Okay.
And I think transparency is sort of the biggest thing. You know, that open and honest transparency of what is actually happening and what's actually been determined out of these studies as we go along. So.
Give in on engagement and feedback.
Again, I'll just go multimedia.
Yep.
So in all, you know, those great TV screens in, you know, GP clinic and every RSL and every whatever place has got
digital
use all every kind of form you can, and as you said, put it into simple plain English that the average human can understand.
Well, I think we're getting yes.
I don't come from this community, but one of the things that I was very aware of during the fire was that on my phone I got a fire study or whatever it's called update every other minute because of something that was happening and continued to do so for a long time after the fires. I think that kind of information though, or that kind of format for throughout the phone network is a useful way of getting information out because you can do updates all the time from a central location, and lots and lots of people can access it. And they can access it almost without having to ask for it because it's just updating all the time. I just found that it was useful to know where the fires were tracking through the CFA site on my phone, and it wasn't information I had to search, it just came up on the phone. So
it might be difficult to actually get something as complex as health study information onto the phone, but it might be a little notice saying you can go here and find this or whatever.
So, but you can feed information back to people about aspects of the study that are in simple language, up-to-date information. Just seems to be a useful form.
The Fire Ready app he's talking about, it's a notification on the phone.
Thank you.
They do it that way. They need to do it through all networks, not just some networks. I got one SMS about the fires. My neighbour across the road got quite a few, and my one that I got was on a global mobile that I have, not on my Australian one.
As we go through the 10 years to look at having forums and information cards for all of our health professionals, GPs included, but even wider than that.
I think health studies are certainly important, and I know that they will take time. The thing that concerns me is often that in the time that's taken to come up with the study, sometimes the important issues aren't dealt with quickly enough. My concern as a long-time teacher and having worked in fire areas prior to this, mainly bushfire areas, is the children. The children will be suffering trauma, and that needs to be dealt with immediately. And it's not something that can wait till a health study is published.
Well, we certainly had that same feedback earlier this afternoon, and it's something that we'll be referring to the recovery program as something they need to address. we're nearly there. We're nearly at the end. I want to make sure that everybody's had an opportunity to say what they wanted to say to come tonight. So if you're done and dusted on that, I might get to the point where we say thank you for everyone for coming. We appreciate your input. As I've said earlier tonight, the issues and concerns you've raised will be documented as part of this process. Some of those will be referred to the recovery program or other agencies to deal with. In terms of the study, the department will be publishing what they propose to do in terms of the brief as a result of all of the information they've received today. If you go away from here tonight and you think, oh, I should have said that, don't forget we have the survey that's on the web at the moment and is still occurring, and will enable you to actually add something in there if you wish to as well.
Can I ask finally, were there many GPs, health professionals here at the last meeting?
Oh, I think we have about 25, 30 health professionals here. Yeah. Yep. So, on behalf of the department, thank you very much for coming and for providing your input. It's been really valuable, I'm sure. As I said earlier, the department's been here listening, and I know they've had their listening ears on, so I'm sure it'll all work well in the long run. And it's the start of a process, not the end, and there'll be lots of community engagement and feedback over the ensuing years. So thank you for being involved.
Can I just add something? It came up at the end of the last one, that a good gesture from the health department may be to offer a free health assessment to all the people that were affected by the fires.
Yep, well, we certainly took note of that, so yeah, it'll be something that the department will try and address in some way. Thank you.
Just add one other thing. As a community member, but not necessarily a representative of the community, could I just say thank you very much to the department for listening to our concerns, that we are concerned about our health, both physical and psychological health, and I'm very pleased to see that this study, at least the process is starting for it, and I'm thankful of that. Thank you.
Thank you.